We're going to talk today about berberine, but we're going to talk about more than just berberine. There's a tendency when we have a plant constituent to tunnel on one constituent in it and sort of lose or miss the ecology of the plant, other constituents that are in it, or we stop looking at the plant as a whole thing itself with its own set of unique properties. Now here let me see this, here are the plants that we're going to talk about and where you find them, and we start with golden seal. This is Hydrastis. Now you'll notice here I'm using the leaves of some of these plants. There are a discovery of beneficial antimicrobial substances unique to the leaves of these plants that are not contained in the roots. Here are these plants, the isoquinoline-alkaloids in some berberine-containing plants. Okay, here are plants: Hydrastis, Mahonia, Berberis, Coptis, and Xanthorhiza. And here's are the alkaloids down the side, most of these alkaloids have antimicrobial or other pharmacological effects in scientific trials, right? And some trials have shown that the combination of these alkaloids, berberine with these other alkaloids, has a synergistic effect on increasing antimicrobial potency. This is a case. Now, this is a picture taken from the internet. It's not an actual picture of the person's MRSA infection, but this was reported to me by a colleague. And the woman was in her 70s. She had a MRSA infection that looked something like this from her knees to her ankles on both legs. And the treatment was persistent applications of a strong decoction of Echinacea angustifolia. And this I would we're not talking about Echinacea today, but a decoction of Echinacea angustifolia is an incredibly potent internal or topical antibiotic. The adverse effects on the microbiome. This is the trial. It compared berberine to metformin with the hypothesis that both acted through altering the microbiome. With doses of 100 and 200 milligrams of berberine per kilogram in mice, again, that's a vast dose, but they reported an absolute increase in butyrate-producing bacteria. So the question, I pose the question, if herbs such as Coptis, Achillea, Artemisia, Allium, Tababuia improve symptoms of SIBO, is it due to antimicrobial, antifungal activity, or is it due to the effects of strong, bitter, and carminative herbs on gastric secretions, bile secretions, and intestinal motility? And I'd like to say this is important. This isn't just theory, and it's not just quibbling, and it's not irrelevant. In one case, we're restoring the terrain. We're supporting normal terrain. And in the other case, we're trying to rid the body of the ill effects of a disturbed terrain, right? And